Hospital infection control. Nosocomial infections are infections acquired in the hospital. There are standard precautions used to prevent the transmission of diseases in the hospital due to contact of the medical staff with blood, body fluid, non-intact skin or mucous membrane, contaminated items, or droplet infections. The precautions used to deal with all individuals, medical staff, or the patient, whether appear healthy or infectious. The standard precautions include the following. First of all, and the most effective precaution to prevent nosocomial infections is hand hygiene. By washing the hands with soap and water and use of alcohol gel to decontaminate the hand. This is the most important precaution to prevent nosocomial infections. Washing the hand and decontamination of the hand should be performed before and after contact with the patient or after touching blood, body fluids, etc. Even when gloves are worn during contact. And also, cleaning of the hand should be done before eating, after use restroom, and after sneezing or cough. In addition to hand washing and hand decontamination, the use of protective personal equipments. The personal equipments include gloves, wearing gloves when touching the patient, touching blood, contaminated instrument, etc. And the use of surgical masks. The use of surgical masks and gowns and goggles to protect the eye. All these equipments should be worn if there is any chance of spray or splash of blood or body fluid. And in the operating room, we should cover the head with a surgical cap. These are the protective equipments for all personnel in the hospital and the medical staff. The third precaution is very safe handling of needles and sharp instruments to prevent healthcare workers or the medical staff from exposure to bloodborne infections. Used needles should be discarded immediately. After use, not recapped, and without removal from the syringe. Used needles, scalpels, and sharp instruments should be placed in sharps waste container, which is a plastic container, and on this plastic container there is this label to take the attention of the personnel that this is the container for the sharp waste instruments, and this is a container for the wastes. This is the waste box for any sharp wastes. Second, safe injection practice. Safe injection practice to prevent transmission of hepatitis B and hepatitis C and the AIDS, HIV virus. Use new needle and syringe with each injection of a patient, and with every time you use a medical vial, or when you use any IV bag. Use new needle and new syringe. There are special precautions should be added in patient with viral hepatitis or HIV virus. The medical staff prone to blood-borne infection with these viruses should be vaccinated against hepatitis B. But I am very sorry, there is no vaccination against hepatitis C or HIV virus. Clear documentation in the patient records so that all personnel know that this patient have hepatitis or HIV. Wearing a high quality full face mask with eye protection using goggle, and wearing double gloves, and use waterproof gown, and scrub hands before and after the operation, and receive sharp instruments. Receive sharps indirectly to and from the vein and to and from the nerves. Put the needles and sharps in this kidney basin. Therefore, put the sharp instruments in this kidney basin and give the basin to the doctor, or the doctor give the nurse all these instruments in the basin. Okay, to avoid any contact with these sharp instruments. Finally, decontamination. Decontamination is removal of microbial contamination by one of the following. Decontamination means removal of microbial contamination. What is the meaning of decontamination? By one of the following. First of all, cleaning. Cleaning is removal of visible contaminations, and this should be done for effective, and this is a necessary prerequisite for effective disinfection and sterilization, which are the next methods for decontamination. For effective disinfection and sterilization, we should remove all gross dirts like dust, food particles, worms, parasites, etc. This is the organic materials and dirts which should be removed. After cleaning, disinfection. Disinfection is reduction of the viable microorganism to acceptable levels. Just reduction, not complete destruction. Because complete destruction of viable microorganism is the next step, which is sterilization. Therefore, we can say that disinfection is a partial sterilization. Disinfection reduces the viable microorganism to acceptable level. And antiseptics. We should identify antiseptics. What are antiseptics? Antiseptics are topical disinfectants that can be safely applied to the epithelial tissues. For example, to antiseptics, which are very, very good antiseptics, are povidone iodine. Povidone iodine used for skin preparation, rapid hand washing, and for open wounds. Povidone iodine is effective against the gram-positive and the gram-negative microorganism. And this is the usually used, this is the commonest disinfectant used in the hospital. Also, ethyl alcohol 70% is used for skin preparation. Disinfection of medical instruments, not like the skin by povidone iodine or ethyl alcohol. Medical instruments usually disinfected by boiling water or by chemical disinfection. The commonest chemical disinfection is glutaraldehyde, which is in the market called Sidex. If we put the instruments in glutaraldehyde for short duration, this is chemical disinfection. But if you put the surgical instruments like laparoscope or endoscope in the glutaraldehyde for long duration, this is sterilization. But we should notice that after immersion of the instrument in glutaraldehyde for short or long duration for disinfection or sterilization, the instrument should be washed by saline, sterile saline, because glutaraldehyde is toxic material for the body. Therefore, glutaraldehyde long immersion time is sterilization. Short immersion time of the stimulants is disinfection. Now we reach sterilization. What is sterilization? Sterilization is complete destruction of all microorganisms. Any microorganism, bacteria, spores, virus, fungus, any microorganism. How you can sterilize instruments or the draping or casters or syringe or needles. First of all, sterilization by heat. The standard method for sterilization is autoclaving. What is autoclave? Autoclave is hot steam. Steam at 135 centigrade under 2 atmospheric pressure for 20 to 30 minutes. This is the instrument which is called autoclave, by very hot steam under pressure, under 2 atmospheric pressure for 20 to 30 minutes. This is commonly used for the instruments. There is chemical sterilization. Chemical sterilization is used if heat is not suitable for sterilization. Heat not suitable for sterilization like endoscopy, laparoscopy. Therefore, chemical sterilization by glutaraldehyde, immersion of this instrument, laparoscope or endoscope, for long duration in this chemical material. And this is very effective against hepatitis and HIV or any bacteria. And we said before, after sterilization by these chemical materials, the instrument should be washed by sterile saline to avoid toxicity by glutaraldehyde. In addition to heat and the chemical sterilization, there is irradiation. Irradiation is used in industries by gamma rays or ultraviolet rays to sterilize casters or syringe. This is industrial sterilization, not hospital sterilization. Also in hospital sterilization, there is gas sterilization. Gas like ethylene oxide gas. Ethylene oxide gas for the rubbing equipments. Rubbing equipments or rubbed equipment which cover the patient, the towels. And there is plasma gas for delicate casters and endovascular wires. This is the hospital infection control, or what is called nosocomial infections. Control of nosocomial infections, which are the infections acquired in the hospital. All these standard methods used to prevent hospital transmission of infection to the patient or to the medical staff. Thank you for good listening and good luck.